Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Federal government advocates strengthening of environmental services for better resilience against disease outbreaks. First phase of vaccinations approach completion in more states with minimal discomfort. And World Health Organization decries lack of equity in COVID-19 vaccine administration between rich and poor nations. Last night, 83 confirmed cases of COVID-19 were recorded in Nigeria. The NCDC confirms that 14 states reported new cases, including Lagos, Rivers, Nasarawa, Cross River, Ondo, Delta, Akwa Ibom, Bauchi, Zamfara, Kaduna, Ebonyi, Sokoto, Ekiti, and Kano states. Till date, over 160,000 cases have been confirmed and over 154,000 have been discharged. The total number of deaths from the disease has remained the same since the last time the country recorded a fatality, and that was April 1. While Nigeria is the country with the least death toll among the top 6 most affected countries by COVID-19 in Africa, other countries most affected by the virus on the continent include South Africa, Tunisia, Ethiopia, Morocco, and Egypt. Over 134 million global coronavirus cases are recorded across the world, with countries like the US, Brazil, India, France, and Russia the top 5 affected. Health experts believe the death toll, like the number of those infected, is likely higher in Africa, with Nigeria testing less than 1% of its 200 million population. So far, Nasarawa has the highest cases still on admission for COVID-19, followed by Ondo State with over 1,000 cases. Delta is third with 798 cases currently. Adamawa State is managing 745 patients. And in 5th place is Lagos, the epicenter of the pandemic. According to the NCDC, Kogi and Niger states have no cases on admission. The Minister of Environment, Mr. Mohammed Abubakar, is seeking the strengthening of environmental health services in the country to mitigate the impact of future pandemics. Speaking at the 14th meeting of the National Council, he explains that while strategies are on to contain the impact of the coronavirus pandemic on the economy as well as the environment, sound policies as well as regulatory laws on the environment remain key to addressing likely impact of the disease.
The 2021 Global Outbreak Risk Report, recently published by the Economic Forum, affirmed that issues that border on environment, such as climate change and loss of biodiversity, are among the top long-term risks that the world would likely face in the next 10 years. This report is expected to serve as a clarion call to innovatively take a transformative action that is commensurate with the magnitude and complexity of this emerging situation in the world, especially as it relates to the ecosystem. During this meeting, discussion for nature-positive action should be encouraged. It is obvious that the mechanical approach to reversing trending environmental challenges is limited in its ability to deliver. It is in the view of this that a new narrative tagged nature-based solutions to climate change adaptation and resilience emerges.
Vaccination campaign against COVID-19 with the Oxford AstraZeneca vaccine is ongoing in Ebonyi State, with over 14,000 people administered with the first dose. Ebonyi State has made progress vaccinating the most vulnerable frontline health workers and the elderly. The Commissioner for Health made this disclosure while giving an update of the vaccination exercise.
Ebonyi State receiving a share of 46,090 doses of the AstraZeneca vaccines.
We commenced the vaccination exercise.
The Commissioner for Health, Dr. Daniel Umezirike, says the government, in a bid to ensure better utilization of the state tranche of his own share, decided to focus on the frontline health workers, then attend to the elderly in the state.
We have vaccinated a total of 14,770 people in Ebonyi State, and includes frontline healthcare workers, strategic leaders, and some very key social workers like drivers, and also people that are above 60 years of age, because they are more vulnerable to the disease. So they've been making a priority list, and that is the number we have vaccinated so far.
With most people getting the first dose of the vaccine, it is important to ensure that the strategies being deployed in the vaccination process is very effective and transparent in order to translate to achieve the expected result.
The vaccination is going on very well in the state. The only thing is that it's not like a mobile strategy. The strategy used this time is more of fixed, where they will stay and people will meet with them.
Beyond the vaccination exercise, we took a tour around Abakaliki, the Ebonyi State capital, to see how the people are complying with the NCDC protocols. We observed that most people are not adhering.
Yes, we've seen and we know that it exists and it kills. So it's better you get vaccinated so we get rid of it completely.
Coronavirus, it is good for us to prevent ourselves from coronavirus by putting on the mask and keeping our environment clean.
Government is doing their best in making sure that people comply, but you can see that there is no law enforcement agent or task force.
It is important to note that being vaccinated does not imply dumping the NCDC protocols, and the advice is that people continue to observe social distancing, wearing a face mask, and constant washing of hands.
But over in Kwara State, 106 people out of the over 55,000 who have been vaccinated in the state have reacted to the Oxford-AstraZeneca vaccine. This is according to the Executive Secretary of the state's Primary Healthcare Development Agency, Dr. Nasirat Elelu. According to her, the doses of vaccines received in the state, over 34,000 have been vaccinated. Most of the complaints, she says, include headaches, chills, or pain at the injection spot. The Executive Secretary is also appealing to residents to get the shot and says the second dose can only be given when the next batch of vaccines arrive.
Kwara State received 55,790 doses of COVID vaccine, AstraZeneca. So far, we had a 10-day campaign that ended on 26th of March. And so at the end of that campaign, 34,112 people were vaccinated. The reports that we've had so far are about 106 have reported mild complaints, including myself. We had majorly complaints of headaches, mild headaches, low-grade fever. Sometimes people have swelling at the site of vaccination. We have cards that have been issued to people that have received the vaccine where they have a number on it to call if there is any untoward reaction from the vaccination. As a matter of policy, the country is going to monitor adverse reaction for the next 42 days after vaccination.
Still to come, we have more updates from Ebonyi State, plus the Global Update report. Join us again. Welcome back. The German federal government is planning to pass new legislation to allow it to impose uniform coronavirus restrictions across the country, taking control from the state. According to a government spokesperson, the country's 16 state premiers have agreed to new legislation to allow the change so it can better fight the surge in COVID-19 cases. Well, joining us to talk more about this, Chiponda Chimbelu is a Deutsche Welle correspondent. He joins us from Berlin for more. Hello, Chiponda. What's the biggest challenge facing Germany in managing the pandemic?
Well, one of the challenges we've seen here in Germany is really managing the interests of the German states, the federal German states, and the federal government. What is really happening is that you can't see the policymakers come to an agreement because some federal states have very low COVID cases and others have very high cases. So that's one of the problems. We've also seen 2 German states take matters in their own hands in terms of vaccine procurement by going ahead with negotiating with the Russian authorities on the Sputnik V vaccine, and that's Mecklenburg, West Pomerania, and Bavaria. So they negotiated ahead of the negotiations that would be done by the federal health ministry, which are going to take place because they've said they will be doing that. So that's definitely something that we've seen. So it's this tension between the interests of the federal German states and the federal government. And that is something that people here in Germany have been watching with a little bit of amazement because, of course, this is a crisis and they would like to see politicians agree on how to move forward.
And because of the pandemic, Germany's budget deficit is at its highest level since reunification. Tell us, what has been the response from Germany to the calls from the US for a global corporate tax?
Well, the German finance ministry has, of course, welcomed the efforts by the Biden administration to come up with a proposal on how to deal with corporate taxes on a global level. Now, one of the problems, with corporate tax is that companies, multinationals, have been able to declare their taxes in low tax jurisdictions. And by doing so, they haven't paid as much as they should be doing because, of course, there are areas in the world where they can pay lower taxes. But now that countries like the US, Germany, they all need tax revenue because, of course, this crisis has been hard on their economies and they've had to borrow heavily as a result of that. Germany's deficit is now at 189 billion euros. That's the highest level since German reunification in 1990. So, of course, making sure that the companies that are making money here can pay back in the form of taxes, that would be a good change. And that is something, of course, that is being welcomed by the finance ministry, which has been trying to work on this for years with, of course, the US and other major economies in the world.
Finally, where is Germany headed? Can it get the pandemic under control?
Well, in terms of moving forward, it's quite clear that health professionals here in Germany want to see a hard lockdown. And in fact, they're warning that there aren't enough intensive care unit beds left. Of course, there's some left, but there's not enough left given the way the crisis is unfolding. But the politicians, like I mentioned earlier, cannot really agree on something. And they were supposed to be meeting on next Monday, but we don't know if that's going to happen. So that's the federal German Chancellor Angela Merkel and the German state premiers. They are supposed to discuss whether we'll be having a hard lockdown or we'll be lifting any restrictions and how to go about this on a national level. And that is something that we will have to wait and see either on Monday, as was planned, or perhaps even Wednesday, as some are saying that the meeting might be moved. So it's sort of a game of wait and see.
All right, many thanks, Chiponda Chimbalo, Deutsche Welle correspondent. Thanks for that update. And now to some news just back in Nigeria. The Lagos state government has further eased restrictions on social event centers across the state. This was disclosed through the Ministry of Tourism, Arts and Culture and the Lagos State Safety Commission. The Director General of the Lagos State Safety Commission, Lanre Mojola, stated that the Governor of Lagos State has approved further easing of social centers across the state with immediate effect. All event centers must hold a valid license of the Lagos State Ministry of Tourism, Arts and Culture prior to operating as an event center in the state and register and verify on the Lagos State Safety Commission website before going ahead with any ceremony. According to the Safety Commission, marshals will be deployed across the state to ensure attendance does not exceed 200 people. Occupancy limits at any event must not exceed 50% of the maximum design capacity of the hall, wherein occupancy limit stickers provided by the Lagos State Safety Commission must be boldly pasted at the entrance of the event hall. Head of the Global Health Agency, the World Health Organization, says over 87% of the more than 700 million doses of coronavirus vaccine that have been administered worldwide have been given in wealthier countries. Dr. Tedros Ghebreyesus says on the average, 1 in 4 people in rich countries has received at least one dose of the COVID-19 vaccine, compared to only 1 in 500 people in low-income countries. Here's more on our global update.
India's daily new COVID-19 cases has surpassed 130,000 for the first time since the outbreak, according to official data released by the country's Federal Health Ministry. The country has recorded over 13 million cases. As of Friday morning, nearly 12 million people have been discharged from hospital, while 979,608 remain in hospital. Japan has placed Tokyo under a new state of emergency to combat surging COVID-19 infections less than a month after the capital and host of the Summer Olympics lifted a broader state of emergency.
Today, I have decided to place Tokyo, Kyoto, and Okinawa under expanded coronavirus measures. The period for Tokyo will be from April 12 to May 11. For Kyoto and Okinawa, it will be April 12 to May 5.
Concerns about a new wave of infections are rising, especially with the hosting of the postponed 2020 Summer Olympic Games quickly approaching. In Brazil, President Jair Bolsonaro called for a middle ground to be reached regarding the imposition of lockdown in the country after it set a daily record of 4,249 COVID-19 deaths. On Thursday, Brazil's Supreme Court also ruled that state and municipal bans on religious gatherings were legal, in a blow to the president, who has described them as an attack on religious freedom. German's Federal Minister of Health, Jens Spahn, has announced that the country is in need of a nationwide lockdown to break the COVID-19 wave, as the number of intensive care patients is hastily rising, leaving hospital under intense stress. According to him, projections show a lockdown should last between 2 and 4 weeks. And finally, British Transport Minister Grant Shapps gives hopes to residents as he announces the British public can now think about booking summer vacations abroad. This will be possible through the government's new traffic light system for travel, which will include countries falling into red, amber or green categories based on COVID-19 risks. Green countries will require a PCR test for travellers once they arrive back in the UK.
Continue to take responsibility as you go into the weekend. The virus is still out there. For more updates and a better understanding of the pandemic, take a look at our website. It has more updates and you can see several stories there. Also, politics, business and sports, all at your fingertips. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.